University of Toledo students have varying opinions on President Barack Obama's healthcare reform.
Working towards universal healthcare is a good thing. I mean, look at other countries that do have universal healthcare, because he's not calling it universal healthcare, but ultimately that's what he's saying it is. And some of the countries that do have universal healthcare, you see patients that do have insurance, that pay good money for their insurance, waiting months to see a specialist because it's universal healthcare. If everyone is given healthcare, do you know how long it's going to take you to get into a specialist? And on top of that, we already have a shortage of nurses. So it's going to increase patient care load on every nurse that already has like a high patient care load, which is going to decrease quality of care. So while increasing financial obligations and decreasing quality of care, what is that doing for our nation? What is it doing good for us? Nothing. And it's also giving that thought of mind that, you know what, you don't need a job, you can get health insurance. You know what I mean? You're getting free health insurance. It's not a good thing.
Not all UT students feel as opposed to the healthcare reform, but some of the students agree that a change is needed.
I don't like the way it's being executed, but I do like the idea of trying to help people do it. So it's like how it's being done. It's what I don't like. Okay. So
One of the students we talked to likes that people who have a pre-existing condition can no longer be turned away for health care.
I really don't know that much about it. I mean, I know that it's supposed to help, make it easier for people to get insurance. I know that apparently, it'll take the healthcare companies, all the insurance companies, can kind of, make them stop making so much money off of people and make it a little more generalized. I think they call it socializing it. So far, I haven't heard anything bad about it. It doesn't seem like a bad idea.
Okay. Is there anything in it that, from what you've heard, that might affect you in some way, or is there any way that it might benefit you, or I guess I could say, harm you too?
Not really harm, but my mom, her health insurance was canceled due to a pre-existing condition, so they wouldn't let her renew it. And she's been without health care, and she's been without her medications and all that. We've been paying out of pocket for it. So from what I've heard, this bill will make it a lot easier for us to get a new form of health care, which would be a great help, so we're not paying it out of pocket all the time.
Students also care about the potential economic effect that healthcare reform will have.
I like it.
Yeah, I think it's a good idea, especially for the age being raised to 26, because it's so hard for college students to afford, let alone get a job, to be able to afford
Especially full-time students. We don't have enough, right? And then after 18, we get off of our parents' insurance or something.
especially how much Toledo, I don't know if I can say this, but Toledo charges. If you don't have, I know I didn't have insurance before I came to Toledo, and then taking the Toledo insurance is really, really expensive, and they charge you for the summer as well. So it's definitely difficult.
Well, I was a little disappointed that we weren't able to get the public option through. That was kind of a blow to me. I do, however, agree that what we've done is better than absolutely nothing. I think that over time, just like with the original healthcare reform with Medicare, things will improve over time as we begin to add more policies and refine them towards helping people, especially people like me who can't really afford healthcare all that easily.
UT College Democrat President Brad Davey believes that a lot of good will be done by healthcare for college students.
I certainly think that increasing students' availability to be on their parents' health insurance until the age of 26 is a monumental step. Essentially, if you're deciding on whether grad school or continued higher education is right for you, I think that you have to kind of do a cost-benefit analysis, and I think when students start to think about things like cost of living or textbooks, they also add in factors like, wow, now I have to be on my, I have to be on my own with healthcare, and that could essentially be the straw that broke the camel's back, and I think when you give students the opportunity to continue their education, you can do anything possible to make that burden a little bit easier. I think that that it's a game changer for students, and I think a lot of this discussion about whether the bill's good or bad. And I think students don't necessarily look at the positive effects on them as, under 26. They get kind of caught up in this debate that's in Washington and, you know, on the streets, but they really don't kind of think about what's going on here on campus and what it does for them. So.
While some of the effects of the new health care bill will go into effect immediately, it is anticipated that the bill will be in full effect in the United States by the year 2012.